Hello everyone, my name is Dr. Gail Roboz and I'm the director of the leukemia program at Weill Cornell Medical College and the New York Presbyterian Hospital in New York City. Today I'd like to discuss a specific clinical trial that was originated at the MD Anderson Cancer Center and is now available at several different sites, including the 6 participating centers of the MDS Clinical Research Consortium, or CRC, of which I am also a member. You can find many of the details about the CRC and about this trial in particular on crushmds.org, our website. MDS, or Myelodysplastic syndrome, is a disease of the bone marrow. The bone marrow is the factory that produces your blood cells, red blood cells that carry oxygen, white blood cells that fight infection, and platelets, the tiny cells that help you clot if you get a cut. Actually, myelodysplastic syndromes are quite complicated for most patients to understand because some patients are told that even though they have the disease, it might take many months or even years for it to get worse, while other patients are diagnosed with so-called high-risk or more aggressive forms in which more urgent therapies are recommended. Patients find this very confusing. They're told if they have a low-risk disease, there might not be much to do. But if there's a high-risk disease, they need to act urgently. And yet the doctors usually are pretty straightforward about not knowing the exact borders for individual patients about when to recommend treatment. There are 3 FDA-approved medications for myelodysplastic syndrome, none of which are curative. I would like to discuss specifically Vidaza, or azacitidine, and Dacogen, or Decitabine. These 2 drugs are not standard chemotherapies. They work through a different mechanism that's called hypomethylation, and there are other websites and other videos that we've made to try to describe this in more detail. But actually, the drugs are similar in many ways, and patients have a very difficult time sometimes choosing which one of these 2 excellent FDA-approved agents is best for them. Furthermore, it is particularly unclear which low-risk patients with MDS might benefit from one of these therapies. Maybe they'll just make blood counts better, maybe they would improve quality of life, might they even improve overall survival? We don't really know the answer to these questions for many patients with what is termed lower risk disease. And because the drugs are commercially available, most patients who are treated actually aren't really studied in any systematic manner, so that when you come in and you ask me, well, I have a low risk disease, what if I take azacitidine or decitabine? Is it going to make me live longer? We actually don't know the answer. And one of the reasons behind the current trial is to specifically study the differences for low-risk patients between azacitidine in 2 different schedules and decitabine in a shorter schedule than what is commonly given to patients with higher risk disease. What do I mean by this? We don't really know what is the right number of days of azacitidine or decitabine to give to a lower risk patient. Is it 3 days? Is it 5 days? Is it 7? These aren't numbers that we're going to be able to know the answer to unless we study patients in a clinical trial and compare which is better, 3 days, 5 days, 7 days. We're never going to know the answer unless we do the studies, and patients really want to know, are they signing up for 3 days of therapy? Are they signing up for 5? Are they signing up for what dose of which medication? I would encourage you to strongly consider taking a look at the eligibility criteria for this study with your doctor if you're a patient with lower risk disease and you're considering starting on one of these 2 drugs. I think it's very important to get a sense of what we do and don't know about the outcomes of treatment with these therapies if you have low-risk disease. And if you're able to participate in the study, it will be wonderful not only for you, but also for the world of patients with MDS to start comparing you guys together and figuring out whether we can actually predict which one of these therapies might be the right choice for you. Each individual hospital that's participating has an investigator who will go through the consent form with you. But if you're not sure whether you're eligible or even whether you could get to one of our centers, please do call, and you'll find many links to areas that are hopefully close to you on crushmds.org. We would like to hear about your situation, and we'd like to see if we could help you participate in this important trial designed for patients with lower risk MDS.